Hi viewers, good morning everyone. Hope you all are fit, healthy and fine. Welcome once again in our channel rgcsk.edu. Hope everyone is healthy, fit and fine and ready for our live class. You all know today we are having the class of Midwifery and Obstetrical Nursing. The topic is Hyperemesis Gravidarum. So we will discuss today introduction of Hyperemesis Gravidarum. What is the meaning and definition of Hyperemesis Gravidarum? Etiological and risk factors, that is the causes. And we will see about clinical manifestation, that is signs and symptoms of Hyperemesis Gravidarum. And we discuss about what are the investigations, management, including the nursing management, prevention. Let us start our class with the introduction of Hyperemesis Gravidarum. So pregnancy, for every mother, it is one of the dream and they wanted to be happy and enjoy throughout the physiological changes during pregnancy. But what happens if the women have the complaints of nausea and vomiting, and the vomiting is severe, she will have disturbance throughout her day-to-day activities, and this will affect emotionally and social relationship of the woman. So she cannot enjoy her pregnancy throughout the period. So here comes Hyperemesis Gravidarum. So let us discuss. Hyperemesis Gravidarum, it is an excessive form of vomiting. Normal in the pregnancy, for 50 to 80% of all the women, they have the symptoms of nausea and vomiting. That is known as simple vomiting or emesis gravidarum. So this emesis gravidarum, this will start during 4 to 8 weeks of gestation, and it will be having a peak during the 8 week of gestation, 8 to 12 weeks of gestation, and this will reduces the symptoms at 20th week of pregnancy. If the woman continues after 20th week of pregnancy having a severe form of vomiting, then we can tell as hyperemesis gravidarum. So with the dietary management and home care management, most of the simple type of vomiting, that is nausea and vomiting or the morning sickness, can be controlled by the pregnant women. If it is excess, home care management cannot be maintained and the woman has to be hospitalized. Let us see what is the meaning of hyperemesis gravidarum. Hyper, what is the meaning of hyper? Hyper means excessive. Emesis means vomiting. Gravidarum means pregnancy. So hyperemesis gravidarum means excessive vomiting during pregnancy. So let us see what is the definition of hyperemesis gravidarum. Hyperemesis gravidarum, it is an excessive vomiting during pregnancy that will deleteriously affects the health of the woman and disturbances in her day-to-day activities. And this can be characterized by starvation, dehydration, metabolic acidosis, alkalosis, and women have the problem of more than 5% of pre-pregnant weight loss. And she can have the nutritional deficiency also. So from the definition, what you understood? The hyperemesis gravidarum, that is meant by excessive vomiting during pregnancy. If the women have excessive vomiting, what happens? Her health will be affected. When her health is deleteriously affected, this can even harm for her day-to-day activities. She cannot even perform any work. Always she will be lying in the bed. She cannot get up from the bed due to this problem, that is the vomiting. And what happened? Her body will lead to so many metabolic, biochemical and circulatory changes. As a result, she have dehydration symptoms, starvation, ketoacidosis and metabolic problems of alkalosis, acidosis, and she have a severe muscle wasting and more than 5% of pre-pregnant weight loss can be happen for the women. And severe nutritional deficiency also can be happen. So this has to be early identified and prompt treatment has to be given. So when we are giving a proper antenatal care, we can reduce so much of life-threatening condition for the women. So severe complications can be happen for hyperemesis gravidarum. It is not a simple condition that happen during pregnancy. This can have a life-threatening and serious complications for the women. So next, we will see what is the incidence of hyperemesis gravidarum. Nowadays, the incidence comparing to previously of 30 years back, now it is reduced. 1 in 1000 pregnancies can be happen hyperemesis gravidarum. Simple vomiting can be seen 80 to 90% of cases, and this will happen till 20th week. If it is more than 20th week of gestation, then severe type of vomiting, that vomiting can be protractable type of vomiting also, and this will lead to hyperemesis gravidarum. Nowadays, due to the family planning to prevent the unplanned pregnancy and proper antenatal care, that is antenatal checkup, and the women having a proper administration of medication in the treatment management, that is antihistamines and antiemetics throughout the pregnancy, we can prevent the complications for the mother and the fetus during pregnancy as a result of hyperemesis gravidarum. Next, we will discuss what are the causes and risk factors. Causes, let us discuss the causes. Main cause is unknown etiology. What is the main reason? We cannot tell. We can see a multifactorial causes for getting hyperemesis gravidarum. Multifactorial causes can postulate us as theories. First one is hormonal factors. Hormonal factors, like you all know about the hormone, that is HCG, human chorionic gonadotrophic hormone. That is the hormone that is secreted from syncytotrophoblast layer during the pregnancy, that is of the placenta. And this HCG hormone will induce us the nausea and vomiting during pregnancy. Some of the condition, the HCG hormone will be increased in the pregnant mother body. Some conditions such as multiple pregnancy, if the women have more than one fetus in the uterus. And another condition is hydatidiform mole or molar pregnancy. Molar pregnancy, it is one of the placental abnormalities where clusters of vesicles that is formed in the uterine cavity. In the clusters of vesicles, so many beta HCG hormones will be produced. Due to the elevated level of beta HCG hormone, that is human chorionic gonadotrophic hormone, the women have the sensation of excessive vomiting during pregnancy. This is one of the hormone. Next hormone is estrogen. Some of the women during pregnancy, in the bloodstream, estrogen level will be increased. As a note, hyperemesis can be happen. And another hormone is progesterone. Progesterone level, if suppose needed, progesterone is very much needed during the pregnancy. When the level is increased, what happens? This will lead to relaxation of the cardiac sphincter in the stomach. That is the connection between the esophagus. Here, when the cardiac sphincter is relaxed, so much of gastric juices will be stagnated inside the stomach, and the gastric mobility also decreases for the pregnant women. As a result, reflex action, the women can go with vomiting. And another hormones like endocrine factors, if suppose the women have the condition of hyperthyroidism or hypothyroidism, subclinically or clinically, the women have more incidence of getting hyperemesis gravidarum. And she have the problem of diabetic mellitus, endocrine. As a result also, she can get hyperemesis gravidarum. Other hormones such as peptin, pregnancy associated plasma protein. So these hormones, when the level is increased, the women have the risk for getting hyperemesis gravidarum. And corticosteroid hormones. Next, we'll see psychogenic theories. Psychogenic factors. If the women have any anxious, and the women have, due to some physiological symptoms, she will have more stress on psychologically. If the women have vomiting, she have some physiological changes. As a result, she will have more stress during her pregnancy. And some women, if they have bad water, different smell of the different food items. By getting it only, they will have the sensation of nausea and vomiting. Next one is nutritional factors. If they have any deficiency disorders, if they have deficiency of vitamin B6, pyridoxine, vitamin B1 thiamine, and protein deficiency, and any depletions of carbohydrate, they can have hyperemesis gravidarum. And another one is any allergic disorders, immunological disorders, the women can risk for getting hyperemesis gravidarum. And they are associated with any medical illness. If the women have the problem of appendicitis, gynecological problem of polycystic or ovarian tumor, so during the pregnancy time, they can have a hyperemesis gravidarum. Let us discuss what are the risk factors for getting hyperemesis gravidarum. Risk factors: first pregnancy. When the women get first time pregnancy, that women are higher in risk for getting hyperemesis gravidarum. And the women of younger in age, very young age, they are getting pregnancy, they are also risk for getting hyperemesis gravidarum. And genetic or familial history. If the woman mother or sister during their pregnancy, they have hyperemesis gravidarum, during her present pregnancy, she can also get hyperemesis gravidarum. And previous history of hyperemesis gravidarum. So first pregnancy, she is having the severe form of vomiting. Subsequent or repeated pregnancy also, she can get hyperemesis gravidarum. And she is of unplanned pregnancy. She didn't have any family planning. She directly go with pregnancy. After first pregnancy, so the subsequent pregnancy happen with unplannedly, that women are risk for getting hyperemesis gravidarum. And the female fetus, researches is going on, the women having female fetus, they are having risk for getting hyperemesis gravidarum. And according to the body mass index, if the women having underweight or overweight, those type of women, they can have a risk of getting hyperemesis gravidarum. And women having the history of smoking, that women have the risk for getting hyperemesis gravidarum. And those who are living in a low socioeconomic status, that are risk for getting hyperemesis gravidarum. And the present pregnancy, the women have pregnancy such as multiple pregnancy or hydatidiform molar pregnancy, that women also are more prone for getting hyperemesis gravidarum. So these are the main risk factors for getting hyperemesis gravidarum. Hope you are clear about the causes and risk factors of hyperemesis gravidarum. Let us see what are the changes that happens for the pregnant women. If the woman having hyperemesis gravidarum, she will go with metabolic changes, biochemical changes, and circulatory changes. First, we will discuss about what are the metabolic changes. When her body having loss of food intake or decreased food intake, there will be depletion of carbohydrate. What happened? The woman body will utilize glycogen from the body, that is from the muscles or from the liver. And when once the glycogen is reduced, they will next step, they will go with use of fat and the protein. So in their body, what happened? Ketones will be deposited in the blood, and acetones will be excreted through the breath and through the urine. And the protein also can be seen in the urine. So these are the major changes in the metabolic. Then next we will see biochemical changes. What happened in the biochemical changes? Due to the starvation and dehydration, what happens? The women will have continuous vomiting. Due to this continuous vomiting, excessive loss of water and sodium chloride from the vomiters. And this will lead to decreases of electrolytes such as sodium, potassium, and chloride in their body. Women will have the problem of metabolic acidosis and alkalosis. This will lead to they will have hypoglycemia, hypoproteinuria, and they can have hypovitaminosis. So these are the biochemical changes that happens due to hyperemesis gravidarum. The next one is circulatory changes. In the circulatory changes, what happens? there will have more hemo concentration, more deposition of hemoglobin, RBC level will be increased, WBC level will be increased, eosinophils. So these are the commonest findings we can see in the lab investigation. So these are the major changes that happens due to excessive vomiting during pregnancy. That is metabolic changes, biochemical changes, and last one is circulatory changes. And so many pathological changes will happen to different systems. Brain can be affected due to hemorrhage, and heart also can be affected, and cardiac collapse can be happen in the severe and protracted type of hyperemesis gravidarum. And liver, fatty liver can be happen, and kidney, the convoluted tubules will be affected, and this will leads to decreased urine output. And the eyes will be, retina will be affected, retinal hemorrhage, blindness can be happen. Women will have the problems of convulsion and seizures. So different life-threatening problems the women can happen if we are not treating in the early phase itself. Next, we'll discuss what are the clinical manifestation we can see for the women, pregnant women with hyperemesis gravidarum. Signs and symptoms. What are the symptoms? So the woman will complain she have a mild vomiting, means she have the vomiting, but day-to-day activities will be disturbed, but she don't have the symptoms of dehydration and starvation. She can able to do her day-to-day activities. Somewhat she can manage her day-to-day activities. But in severe or protracted type of vomiting, the women have severe retchable vomiting with her day-to-day activities will be disturbed. She cannot do any activities, and her vomiting will be so much of severe, and she have the symptoms of complication also. So first we'll see what are the symptoms. The women have she have nausea, vomiting, tiredness, fatigue, and she have continuous vomiting will be there, and she feel like excessive tiredness. She feel like stylism, that is excessive salivation. Excessive salivation secretion will be there, and spitting of the saliva, and she will be very much tired, sick, and she always will be in the bed, and she cannot do her day-to-day activities. What are the signs we can see from the women? The women will have the signs of dehydration. So dehydration, the women will have pulse, variation of the pulse, tachycardia will be there. She have decreased BP, that is hypotension, and she will have the problem of decreased urine output, sometimes anuria or oliguria. That symptoms can be seen. When we are collecting, we can assess. Then as the women have like sometimes a conscious problem, she have like a heartburn will be there, she have decreased urine output will be there, she will feel like very much restless, tired, and dry mouth will be there, clotted tongues will be there, sunken eyes will be there, and she have the features of constipation. And another one signs we can see is orthostatic hypotension or postural hypotension. When she is getting up, her BP will be dropped down. So this also we can classically find in the hyperemesis, severe type of vomiting. And the vomiting is more retchable, and she cannot do her day-to-day activities. And the condition, symptoms, signs and symptoms will be worsened if she have any complications. So these are the general clinical manifestation we can see for the women with hyperemesis gravidarum. And another special features we can see, she can have muscle wasting and weight loss. More than 5% weight loss comparing to her pre-pregnant state. So this also a good signs of severe type of hyperemesis gravidarum. Next, we will discuss about what are the investigations we can do for hyperemesis gravidarum. As a diagnostic evaluation, we can first see the history collection of the mother and do the general physical examination. Detailing in the investigation, first one is urine analysis. Routine urine examination has to be done. Specific gravity, the urine will be dark color and more concentrated will be there, and women have like oliguria, problems can be identified in the urine analysis, and excretion of ketones or acetones, proteins that can be seen in the find out in the urine examinations. And we can see the midstream urine collections that sometimes have the problem of UTI. Next one is ophthalmoscopy. We can assess the fundoscopy to identify they having any retinal detachment or retinal hemorrhage is there. This is for women have the problem of any complications. Next one is blood investigations. Blood investigations, all the level of the blood, normal blood count, hemoglobin, hematocrit, RBC, WBC, eosinophils. Due to the circulatory changes, these levels will be increased. And we can see the liver function test. Enzymes will be increased. And another like creatinine, urea, uric acid, the variation in the levels can be assessed during the blood investigations. And as part of pregnancy, we can see the ultrasonography report. In the ultrasonography report, we have to find out whether confirmation of pregnancy is there. In early gestation week, 6 weeks, 7 weeks, 8 weeks, confirmation of pregnancy can be done. And we can rule out the women have any multiple pregnancy, more than one fetus, or women have the problem of vesicular mole or hydatidiform mole or pregnancy is present, that we can confirm from the ultrasonography. And we can see the ECG. ECG we can assess any variation is there, because hypokalemia problem the women can have. And other like electrolytic levels can be assessed in the blood, sodium, potassium, chloride. So these levels will be decreased. Vitamins also we can see the women will have the decreased vitamin in their body. So these are the major investigations that can be done. According to the complications, the investigations can be done very detailedly for the hyperemesis gravidarum women. Next, we will discuss about what are the management. Management based on, we have to see whether it is a early vomiting is there, whether it is late vomiting. Late vomiting have severe and protracted type of vomiting. Is the women have a very simple type of vomiting less than 20 weeks of gestation, so she can able to manage in the home care. They can correct with dietary modifications, so that we can consider. If the woman having severe type of vomiting after 28th week of gestation, the vomiting is more protractable, and this will affect the day-to-day activities of the women, then we have to consider. Our main principles of management, first one is to control the vomiting, to maintain the dehydration, to prevent the fluid and electrolyte imbalance, and to prevent the early complications for the women, and to prevent the nutritional deficiencies, and to take care of women during pregnancy. So women is pregnant, in her womb fetus is there, so for that also we have to keep it in mind. So these are the protocols that we have to follow during the management of hyperemesis gravidarum. Then as per the doctor's prescription and order, the first one is hospitalization. The woman has to go with complete hospitalization. Bed rest has to be done if she is having severe type of vomiting, because anytime her complications will lead to life-threatening situation. Then second one is fluids. So we have to give proper fluids for the women. So we can give oral solutions, or 5% dextrose can be given, crystalloids, Halmed solutions. According to the need of the pregnant women, fluids can be administered maximum of 3 liters. And we have to monitor how much vomiting is there and how much urine output is there. According to the vomiting and urine output loss of water, that can be calculated, and as per physician order, fluid and electrolytes can be administered. Next one is pharmacological management. So here nowadays antihistamines and antiemetics is very much essential throughout the pregnancy to prevent the complications of hyperemesis gravidarum. So here we can see such as antiemetics, promethazine, 25 mg, IM injection or oral if suppose they are able to take TDS, and they can go with ondansetron drug, antiemetics can be given. And metoclopramide. Metoclopramide, some women they can have the extrapyramidal symptoms. So combined type of drugs therapies can be done for the hyperemesis gravidarum. So physician can see, obstetrician can see what type of drug is needed for each pregnant woman. Each pregnant woman is unique in their behavior of vomiting. So they can see single drug of choice or combined drug of choice. And they can combine with the pyridoxine vitamins, okay, thiamine vitamins, and vitamin supplements also can be given, and included vitamin B1 and vitamin B6. And next one is dietary modification. So here, if suppose the woman is having excessive vomiting, nothing has to be given for the woman, only or IV fluids can be given. Once the vomiting is controlled, then we can start the food and fluids and food for the women. Next step is we have to closely monitor the women have any signs and symptoms of complications, like heartburn is there, severe type of heartburn, blood vomiting is there, any oliguria is there. We have to closely monitor the uric acid, creatinine, all the enzymes levels, whether the kidney is functioning proper. The women have the problem of any convulsions, going to coma, any memory loss is there. So like that, we have to closely monitor the women. And as a result, we have to see the fetus status also. What is the growth of the fetus has to be assessed. And if you want, they can give corticosteroid therapy like hydrocortisone 100 mg can be given for the mother. And if needed, diazepam also given for the mother to get a relaxed one. And psychologically and social maintenance of good relationship with the family members to take care of the patients. So these are the major management that comes under hyperemesis gravidarum. Next, we will see about what are the complications of hyperemesis gravidarum. So nowadays, due to the good treatment and proper antenatal care, somewhat we can manage the complications in the early recognition of hyperemesis gravidarum. But still, most of the women has to be monitored for complications. I told most of the vomiting will be resolved within 20 weeks of gestation. And beyond 20 weeks of gestation, if severe type of vomiting is there, and this can be continued till their gestation, and this will be deleteriously affects the health of the mother and health of the fetus. So complications we can divide it into two. One is maternal complication and another one is fetal complications. What are the maternal complications? Maternal complications, first one is neurological complications. Neurological complications, the women have the problem of Wernicke's encephalopathy. Wernicke's encephalopathy. So here the women have the problem of nystagmus, ataxia, and confusions. So when hyperemesis gravidarum, this will affect the brain tissues. And next one is they can get peripheral neuritis. And they can have the damage of the myelin sheath of the nerves. The women have the problems of numbness and tingling sensations of the hands and the feet. And another one is Korsakoff psychosis. Korsakoff psychosis, the women have the problem of memory loss, unconsciousness. So this type of problems the women can get as a neurological. And sometimes the women have the problem of convulsions, and even she can enter in coma stage. Next, see, she can get severe type of GI disturbances. GI disturbances, mainly she have esophageal rupture, can be walls of the esophageal ruptures. Mallory versus syndrome. The walls of the esophagus can get rupture. And bleeding can be comes. A severe vomiting with blood vomiting can be happen for the hyperemesis gravidarum women. And the women have stress ulcers in the stomach. due to severe vomiting, she can get stress ulcers. Already we have discussed some women, they can have medical problem. Due to the medical problem during the pregnancy, she can get hyperemesis gravidarum, such as H. pylori infections in the stomach. So these cases are more risk for getting hyperemesis gravidarum during the pregnancy, and they can go with the complications of GI disturbances. Next one is the women will have the mood disturbances, sleeping disturbances will be there, and she have the liver dysfunction, kidney dysfunction, even the cardiac collapse can be happen, rectal hemorrhage, blindness. So these are the major problems, and starvation, severe type of weight loss will be there, and more of hypovitaminosis and vitamin K deficiencies, bleeding disorders. So these are the major complications that happen during hyperemesis gravidarum. See, the complications are very severe, and this will lead to more life-threatening problem for the mother. When you see the fetus health will not be affected much, but the fetus can have the problem of low birth weight baby or small for gestational age. So these are the major problems we can see in the fetus. If the mother have any liver function, she have the complaints of jaundice also, that we can assess, and bile excretions can be seen. So these are some of the complications, the mother and the fetus, those who are having hyperemesis gravidarum during pregnancy. Next, we will see what is the prevention aspects. Preventions during the simple pregnancy, simple vomiting during pregnancy. In the early features itself, we have to diagnose the woman is having nausea and vomiting, morning sickness, or she is having the severe type of vomiting. If she is having a simple type of vomiting, we have to ask the mother to don't take full meal at a time. She can divide the meal, and she can take small frequent meals during the daytime. That can reduce the severity of vomiting. And what she has to do, she should not take water or fluid after the meal or before the meal. So what she has to do, in between the meal, she can take the water. And if she is having, if she have any foul smelling, bad odor foods, that can be avoided. Some women, by seeing the food or smell of the food itself, they will feel nausea and vomiting. So the home members, they can see what type of food the women during pregnancy they dislike, or they will have the psychic or sensation of feeling of vomiting. That type of odors or foods can be avoided for the women. Next one is she can avoid the spices, oily food during the pregnancy time if she have the complaints of hyperemesis gravidarum, and type of high fatty foods can be avoided. She can increase the carbohydrate, protein type of meals, and the meals can be bland meals. Spices can be avoided when her nausea and vomiting is controlled. So this they can keep it mild. So varieties or colorful bland diet can be given for the women, and they can give the fruit juices, fluids in order to restore the fluid and electrolyte balance and to prevent the dehydration of the women. If the woman is having severe type of symptoms, and the doctor can be advised for antiemetics and antihistamines. So this BD or TDS, according to the severity of the vomiting, they can be taken continuously throughout the pregnancy to prevent the complications of hyperemesis gravidarum. So like this way, if the women are managing, they can prevent the hyperemesis gravidarum, such as some food like toasted or dry nuts or biscuits or crackers that can be taken in order to prevent high fatty diets. So that will stimulate the woman for hyperemesis gravidarum. Next, we will discuss what is the nursing management of hyperemesis gravidarum. As a nurses, in our day-to-day hospital or in the community field, we can see pregnant women. So pregnant women, entirely, most of the women, they will get vomiting, or that is simple vomiting or emesis gravidarum, that we can advise the general home care remedies. So if the woman is having hyperemesis gravidarum in a hospital as a nurse, first one is we have to assess the condition of the pregnant woman. What type of hyperemesis is there? Whether it is mild type of hyperemesis gravidarum or severe or protracted type of hyperemesis gravidarum, or due to the severities of hyperemesis gravidarum, the woman is having any complications. According to that, we have to maintain the management has to be prepared. Next one is we have to maintain a hyperemesis gravidarum monitoring chart. Hyperemesis gravidarum monitoring chart. In that chart, we have to closely observe, supervise the mother. Daily, we have to enter the pulse, respiration, temperature, BP of the mother, and urine output, vomitus, and we have to see what are the blood investigation, mainly uric acids, any enzymes, main of ketone, acetone. Acetone foul breath will be there, that is fruit type breathing. Smell will be there for the women having hyperemesis gravidarum, or smell in the urine, so that we can assess they having the acetone. So these all we have to monitor and we have to record in the hyperemesis gravidarum. Strict monitoring of intake and output chart has to be maintained as a nurse's role. And whatever prescribed fluids that can be administered, and we have to see the what fluid loss is there through the vomiting and the urine. Vomiting and urine output has to be closely monitored. And whatever medications is there, we can advise the mother to take the medications properly. After that, they can go with the diet and the meals. Next, we have to see any non-pharmacological measures. We can advise one of the choice is ginger. So ginger 250 milligram, they can be twice a day. They can be taken as a dry ginger they can take, or like a liquid form they can take. So this will reduces the vomiting sensations. So these are the, and we can advise the mother what are the activities they have to follow. Taking of meals in between small frequent meals, taking of fluid in between the meals, taking of high carbohydrate protein, avoid the fatty and the spicy food, avoid the smells, and they can take the dry cracked toasted foods to prevent the nausea and vomiting. And proper antenatal checkup and proper follow-up has to be done. Once they are in the home, when they come to the hospital, they are admitted and they have treated and they have controlled the symptoms and they are going back. After going back to the home, again they are getting the symptoms. So they should not wait in the home itself. If they get again the symptoms, they have to come to the hospital. Again, they have to do the blood investigation. First step, they have to see the urine, whether any acetone or ketone is there. Suddenly, the woman will get the risk. So immediately, they will get dehydration, fluid and electrolyte imbalance, starvations, and nutritional deficiencies. So whenever they are having the problem, they have to come to the hospital. They have to screen out antenatally. They have to do the checkup. Then they have to see whether need to hospitalize and they have to get treatment, or they can go in home care. And when we can go with the discharge, by seeing the woman, when nurses can show as the woman is going for discharge and how the condition is there. First one is she has to control her vomiting. Episodes of vomiting has to be decreased or stopped. And she can take fluids and meals. And her body, ketones, uric acid, acetones levels has to be come down. And potassium, chloride, sodium levels has to be balanced. And she should be free from dehydration symptoms. Orthostatic hypotension should not be there. Hypotension, tachycardia, those should not be there for the women. And her body has to be balanced, no fever, no jaundice, and she can do her day-to-day activities. And the fetus also is healthy. So these all features is good. Then as a nurse or the obstetrician, they can decide for the discharge, and as a nurse we can give the discharge education and follow up for the women. So if the woman is continuously doing this, so much of complications for the mother, and indirectly it will affect to the fetus also, that can be prevented and healthy pregnancy can be achieved for the mother. So as a conclusion, as a mother also, pregnant mother also, they have to more conscious about hyperemesis gravidarum. So they should not think vomiting, it is a simple thing. If continuous vomiting for 2 or 3 days, even their metabolic, biochemical and circulatory changes will be affecting, and they leads to dehydration, starvation, electrolytic imbalance, muscle wasting and weight loss will be there. So sudden weight loss, sudden tiredness, not able to do her day-to-day activities, they should not stay in the home. They have to come and do the antenatal for antenatal checkup, and they have to hospitalize and they have to do the intervention. If the women have continuous vomiting, we are giving so much of treatment and management, hospitalization, still the vomiting is not controlled, the final step is termination of pregnancy. Healthy fetus also, for saving the mother life, we have to terminate the pregnancy. But nowadays our medical treatment is good enough to improve the condition of the mother and minimize the complications. So let us join the hand to take care of the hyperemesis gravidarum mothers and to prevent the complications for the future generation. So today class we have discussed about what is hyperemesis gravidarum. That is an excessive vomiting during pregnancy. We have seen the introduction, definition, incidence, clinical features, causes and risk factors, metabolic, biochemical and circulatory changes. We have seen about investigations, management, hospitalization, fluid therapy, electrolytic balancing and pharmacological therapy, and we have seen about the prevention and nursing management. Hope you have understood the class. Again, we will meet you in another live section. I am signing off, Mrs. Nima. So you can